Hello and welcome to tonight's Q&A discussion on well-being for medical students and doctors. Thank you all for joining us tonight. My name is Thomas Nguyen and I will be your moderator for tonight's event. I'd like to first begin with an acknowledgement of country. So regardless of where we might be tuning in tonight, I want to acknowledge the traditional owners of country across Australia and recognise their continuing connection to land, waters and culture, as well as recognise the impacts of invasion and systemic persecution of our First Nations people. I'd also like to pay my respects to their elders past, present and emerging. Finally, I'd like to acknowledge those with lived experience of mental illness, their friends and families. So just a bit about me now. My name is Thomas Nguyen and I'm currently a third year medical student at Western Sydney University, and I'm also president of the Psychiatry Association of Western Sydney, otherwise known as PAWS, where we run academic and wellbeing events throughout the year. I'm also currently a PIF member and am currently active in research looking into refugee mental health and medical education. And if you haven't already guessed, I intend on specialising in psychiatry. So once again, thank you for joining us today for this wellbeing conversation. This event is all about hearing and sharing experiences and strategies for maintaining wellbeing throughout all stages of your medical career, from medical student to doctor. So just some quick housekeeping rules before we start. We want you to interact and be part of tonight's conversation. So please submit questions and comments through the Zoom chat box throughout tonight's event. We also have some viewers joining us through the Facebook live stream, so please use the comment sections on the video to also be involved in the conversation. This event is being recorded and will be made available for later for those who can't attend tonight. And lastly, just remember to keep the conversation professional and respectful. So now I'd like to introduce our two amazing panelists tonight, Dr. Skye and Dr. Tahnee Bridson, both of whom are currently psychiatry trainees with the RANZCP. They're here tonight to talk about their experiences with maintaining wellbeing and to share stories and advice not only as health professionals, but also as former medical students and just human beings in general. So firstly, Skye is a passionate advocate for rural and other marginalised patients and their communities. She was the 2017 Victorian Junior Doctor of the Year and the 2019 Young Victorian of the Year, and also the 2019 Victorian Young Australian of the Year. She was also recently named on the Australian Financial Review's 100 Women of Influence list. Tahnee has worked on various research projects, ranging from immunology, psychiatry to neurosurgery. Her areas of interest are neuroinflammation and biological psychiatry, with a specific focus on child and youth psychiatry. Tahnee is also the founder of Hand in Hand, a binational peer support network for healthcare professionals, which I'm sure she'll tell us more about. So we might start tonight with Skye and Tahnee talking separately about their passion and involvement with wellbeing and advocacy for not only doctors and medical students and what sparked their interests. So maybe I'll start with you, Skye.
Yeah, thanks, Thomas, for the kind introduction, and thank you very much for moderating the panel. It's an interesting question. You know, for me, I mean, one of the things I love about psychiatry has been, you know, the opportunity for advocacy. And advocacy has been a part of my medical journey since I started. It was really one of the reasons I even wanted to become a doctor. I grew up in regional Victoria, and my dad actually had a very severe lung condition and regularly had to travel to Melbourne for care and still does. And, you know, I always found myself looking around and thinking how fundamentally unfair, you know, these things were. And I got involved in a lot of rural health advocacy as a result, but I've done this sort of same process when it comes to wellbeing of, you know, medical students and junior doctors. Again, it's been that process of just looking around me and thinking how fundamentally, you know, wrong or unfair some of these things are, and genuinely wanting to do something about it because I'm in the thick of it, because I actually don't have a choice, because this is my profession and these are my colleagues and these are my students. One of the things that I've been involved with recently that might be of interest, and I know Tahnee's got a great many things that she can talk about too that she's involved with, but one of the things I'm quite passionate about is the wellbeing of medical students. And what I've been involved in doing is trying to increase opportunities for near-peer mentoring of medical students through the University of Melbourne, specifically at the St Vincent's Clinical School where I'm based at the moment, looking at ways that we can actually, as registrars, model, you know, the ways that we navigate some of these challenging cultural issues to do with well-being, given our a few years of experience. And sometimes what that looks like is, one-on-one sessions together, talking with the registrar about, sometimes students, don't know how much they'll get paid as a doctor. They don't know what overtime is. Some of these fundamental parts of being a doctor and things that impact on our well-being are not often discussed at the student level. So sometimes it's just about actually having those conversations one-on-one. But also, I think talking in a group is another part of the near-peer mentorship that I try to introduce at our hospital. Sharing things in front of your peers, being comfortable with being vulnerable in front of each other, because we all are actually vulnerable in front of each other all the time, even if we don't really like it, and getting used to that process of supporting each other and building each other up rather than tearing each other down.
That's great to hear. Tahnee, what about yourself?
Tahnee is enjoying life from a Queensland airport at the moment, which is a luxury that some of us don't have.
I'm so sorry. I just had to mute because there was an announcement and I was going to try not to say it because I know many of you are in lockdown. But yes, I'm similar to Skye in that I actually grew up in a rural town in far north Queensland, and actually very similarly, my dad was unwell as a child, and I saw, I guess, firsthand the difficulties of having quite a lack of resources. And this sort of transpired my interest in medicine, but further down the track, also lost a number of friends to suicide. Living in a rural town comes with a lot of challenges, and isolation and mental health is a big thing in rural and remote Australia. So that kind of sparked my interest in psychiatry. And then obviously when I came to medical school, realised that actually mental health and wellbeing in medical students and doctors was actually a really massive issue. And seeing my friends and colleagues suffer under the kind of pressures that we're placed was something that really, I guess, upset me or made me want to do something about it. And I think the first sort of active steps I took was in the last few years, took on some roles as a wellbeing officer in my regional hospital of Cairns. And, I think sometimes in the more regional remote areas, these things are a little bit more taboo, or there's a little bit, everyone, so you're a little bit less likely to sort of say if you're struggling. And we really put together some programs to encourage each other to speak up and to support each other and to seek help when needed, and to show everyone where they can actually get support from. And from there, I guess my interest has kind of spiraled. And this year with COVID, really wanted to see how we could support each other and what we could do to actually support our colleagues, not just doctors, but all healthcare workers. And with a group of amazing people, including Skye, we've managed to put together a nationwide network, which really is all about sort of encouraging social connectedness, peers supporting peers. There's no judgment. There's no, like Skye said, tearing each other down. It's all about anyone who's needing help can reach out to us, and, we help them to put them in groups or to give them that support that they need to really get through difficult times. And it's come about in the face of COVID, and it's called Hand in Hand, which stands for Helping Australian and New Zealand Nurses and Doctors. But really, it encompasses all healthcare workers. And despite being from COVID, it's something that I think we all know needs to continue, not just specifically this initiative, but all the kind of initiatives and awareness that's coming out of COVID about our own mental health really needs to continue post-COVID. So that's something I'm really, really passionate about continuing and encouraging. And again, sorry for the announcement.
Well, that's really great to hear, Tahnee. As difficult as COVID has been, it's kind of really brought out the best in us, especially with healthcare workers helping each other and just patients also seeing the struggles that frontline doctors face. So I guess you guys alluded to, the role that, mental health stigma and suicides in your personal lives had in getting you guys into psychiatry. So I guess I wanted to ask you both, how can we talk more about the culture of stigma surrounding mental health, and how can we navigate and change attitudes, not only within medicine, but also in our peers outside of medicine, whether it be family or friends?
I think it is difficult, but it's definitely something that we are getting better at and we need to keep working at. I think there's a lot of work that's gone into like awareness and advocacy campaigns, things like Crazy Socks for Docs, Are You OK Day. They really help to raise the awareness, but it's also about like having things that are there to sort of change or actually provide the supports that are needed. I think Skye and I before this were talking about how sometimes it can help just hearing that, you know, other people have also gone through similar things. So I think, like Skye said this before, I'm pinching her words, but showing that vulnerability, showing that we're all human, that it's okay to not be okay. And someone said to me once, you know, we don't live in a vacuum. Just because we're doctors doesn't mean that we don't experience hardships and things, and it's okay to admit that.
Yeah, I think I mean, for me, you know, I mean, there's a great many reasons why medical students and doctors probably have poorer mental health than other people. But for me, honestly, one of the big reasons why I think it is the case is because there are some pretty negative parts of medical culture that still exist. And one of the things I always try to talk to my students about where I can is that actually, you know, by the time you get to being a reg, what you discover is that you get to make a lot of choices as a doctor. The more junior you are, sometimes you don't feel like you can make the big choices, and that's difficult. But even the small choices that you make can actually have profound impacts on the people around you. You know, the example I always give is when there's a medical student standing up the back of a room and nobody says hello to that person, and that person just stands at the back of the room having no idea what they're doing, feeling uncomfortable about whether, can I sit down in the chair? Do I not sit in the chair? Am I too close to the table? Is someone going to tell me off? Am I even in the right room? Is this even the specialty that I'm doing? Like, you know, and all it takes is actually somebody saying, hey, you know, my name's Skye, I'm one of the reggers. Do you know where you're going? Do you know who you're with today? And that takes all of about 10 seconds to do. It's really not a lot of work. And it's a choice. It's a choice that you actively make, and it can make a profound difference to that person in terms of them feeling supported, feeling like part of the team, feeling welcome to be, you know, in your hospital, on your ward, what have you. And the more senior you get, the more of those choices, the bigger those choices are. And the more of an impact that you can make. But even as a junior doctor, even as a medical student, every single day there are opportunities to reject negative aspects of medical culture. And you might not change everything immediately, but you might change things profoundly for somebody in the pretty immediate term.
I think
Yeah,
also,
that's so
like,
true. Sorry, Tahnee.
No, I was just going to say, I think what Skye said is so right, that, you know, you feel like as a medical student or a junior doctor, you don't have that much power. But in fact, we're the ones that can actually change this culture. We're the ones that can change the way we treat each other and, you know, change that stigma around mental illness and seeking help.
Yeah,
I think that's important.
One of the things I often say is, you know, we complain about the system, but at the end of the day, we are the system. You know, we are the people who determine, you know, how our wards run, how we treat each other, you know, whether or not overtime is getting paid in our hospital. These are, you know, there are doctors involved in these decisions. You know, we are the system, actually, and on the one hand, that can sometimes feel a bit disempowering because you're sort of like, well, why hasn't it changed then? But I prefer to think of it as empowering, because it means that we are actually involved and we do have these choices, so we can actually change it.
Yeah, those are definitely true words, Skye. We have actually a question that was pre-submitted before the event, and I guess this kind of ties into medical culture, but at a medical student level. So this person's asked, how do you manage the feeling that you don't study enough or work hard enough in medicine?
I mean, I still feel like that most days. So I don't know if I'm the best person to answer it, except to say, you know, that I remember when I was a student, and I was in Bendigo, which is one of the regional clinical schools in Victoria, and there's a doctor there, Manny Thomas. He'll never see this, but he is a renal physician in Central Victoria, and he's probably one of the smartest doctors I've ever met to this day. He's a phenomenal physician. Like if any of my family members were sick, he is exactly the sort of person that I would want looking after them, because I know that they would get the best care. And I remember he said to me once, I sort of said to him, when do I stop feeling like a massive imposter? And he said to me, well, I've been a consultant for a while now, and I still wake up every day wondering when someone's going to realize that I'm not supposed to be here. And he is probably one of the best doctors I've ever met. So, I don't know if these feelings go away. They don't seem to, from people that I've talked to, but I think it's about accepting actually that it's okay for us to be who we are. We have a big problem in medicine with accepting that. Frankly, we do not feel comfortable as individuals in the profession or as a profession in admitting that we are actually vulnerable, fallible people who make a lot of errors, and we're never going to be perfect. But you can at least acknowledge that to yourself and give yourself permission. I try to give myself permission, to not be perfect all of the time.
Yeah, I agree with everything Skye just said. I think imposter syndrome, that whole, feeling like you're never good enough or you're not supposed to be there. I think a lot of us who get into medicine are that kind of perfectionistic, obsessive, compulsive type personality, where we always feel like we have to do better, or we're not doing enough, or, we always worry about what we might miss, or, if we do the wrong thing by our patients. And something that someone once said to me was that we just have to accept the benign indifference of the world, and that we can't control everything around us. It doesn't matter how hard we try, nothing is going to work out always as we think it should. And that's really hard to accept. And it can, it's one of the factors that I think leads us to burnout and leads us to actually developing depression, anxiety, and having those sorts of, going on to develop suicidal thoughts. But I haven't mastered it. I definitely haven't. And,
I've definitely not.
One example, and, hopefully this will make people feel better knowing that it's something that a lot of us still struggle with. For instance, this webinar to write my biography, I couldn't do it. I did not know what to say about myself. And Sarah from PIF actually had to go on and find some stuff about me, because I just couldn't accept that this was like where I was supposed to be. So I don't have the answer for it, but I just try to learn from those who have gone before me, and recognize that even the people I really look up to feel like this sometimes, and that we just have to accept good enough.
Yeah. The other thing I'd say, just as a shoot off of what you said, Tahnee, you just made me think of it, is I suppose the other aspect of this is, there is always more to be done in medicine, right? And the hospital will always demand more of you. There is never a day where the hospital will stop demanding of you. It will demand, and it will demand, and it will demand. And no matter how much you try to give, it will never be enough for the hospital, because there will always be more to do, and there will always be more that you need to give. And so at some point, and this has been a learning process for me, and a process that I'm, a journey that I'm still going through myself, at some point you just have to decide what your boundaries are. I'm actually not going to do that. I'm actually not going to take that extra shift. This is actually my limit, because the hospital, I think sometimes we like to trick ourselves that the hospital won't push us beyond our limits, but it will. The system, which is actually us, but that's a different point, it will push us further than we actually can go. And we have to, again, make the choice for ourselves to say, actually, this is where I need to stop now. And we need to be okay with that, and not see it as a failing, that we aren't good enough because we couldn't keep going.
Yeah. And I think that's so true. I think something I was told once upon a time is it will keep running without you there. And if you burn yourself out in the process, it's still going to keep going. It's not going to fall apart because you're not there to do it. And, we need to sort of remember those things so that we actually don't burn out. That's the main thing.
Yeah, so lots of great points brought up there. Firstly, on the point of, imposter syndrome, it's a bit kind of daunting, but at the same time comforting that at your level as a registrar, that imposter syndrome is still a thing, but it's, I guess, accepting that it's a normal almost, and being compassionate to yourself. Sometimes just being nice to yourself, being mindful that sometimes those thoughts that maybe I'm not good enough come up, and just recognizing those thoughts, but accepting that, you know, that's not true and that you're capable of doing as much as you can, but also setting boundaries, as Skye mentioned before. But yeah, and going to the idea of like, I guess setting personal boundaries and recognizing, you know, that sometimes the hospital system doesn't always look out for you. I guess that brings up the point that, you know, sometimes there is a place for advocacy and for, you know, students and junior doctors alike to stand up to I guess points where they aren't looking after our mental health. So I guess that's really important also. Moving on to another pre-submitted question, and which kind of goes along the same lines as this idea of burnout. What are some ways we can avoid developing destructive habits of coping with pressures at work and outside work? It feels quite easy to fall into pessimistic attitudes or to become defeatist towards caring for oneself under stresses.
I think it's quite difficult not to fall into those sort of bad habits. I think what Skye said before, putting in knowing your own limits and knowing your own boundaries is really important. And I think something that most people do when they're starting to become stressed or when they're starting to feel overworked is actually lose all those protective coping mechanisms. So, you know, those things that do keep us well, like going for a run or catching up with family, remaining, you know, talking to people you love or you care for, having a coffee, having a nice meal, cooking yourself something healthy. All of those protective things tend to sort of reduce them when you are becoming more stressed. And it's really important to recognize that, I think, and actually sort of actively stop yourself from doing those things and remembering that that is keeping you well. Easier said than done. I know myself that, you know, I generally will forget to go to bed on time or, you know, forget to have a healthy breakfast or, you know, work through lunch, those sorts of things when I am getting more stressed. But it's something that I try to actively remind myself of, that I'm losing those protective things when I'm becoming more and more stressed.
Yeah, I mean, when I reflect on, you know, being a med student and now being a doctor, the times where I've been either the most burnt out or felt probably the most unwell for myself have been times where I've really gotten swept up in the rat race, you know, and you start doing a lot of that, comparing yourself to other people. You know, what are they doing? Where are they at? You know, are they doing this course? Are they studying this amount of, you know, this amount per day? You know, I can't do any of that stuff. And I guess, you know, and again, this is still very much a journey for me as well. But what I really tried to do now is just let it go and remember that it actually there's this sort of like myth, you know, in medicine, that there's this one prototype of there's this attainable, you know, amazing doctor, you know, and everyone can, you know, if you could just be this one specific way, you would be the perfect infallible doctor, and that person doesn't exist. You know, there is no right way to have a medical career, and in fact, people, some of the people who have the most odd, you know, journeys in terms of what they do are some of the most fascinating people in medicine anyway. But you know, it's what I really tried to do, and you know, it is easier said than done, is just focus on myself and just, you know, for me, you know, one of the things Tahnee and I were talking about was, yeah, I mean, there's no way I'm going to get my training done in 5 years. It's not going to happen. And I've accepted that, and I'm fine about that, you know, because I'm doing other things that I love in the background, extracurricular things that make me happy, that I want to be doing, talking at things like this, for example. You know, I don't want to give that stuff up and you know, just focus on my exams to get done in an arbitrary amount of time that doesn't even really mean anything. You know, so again, it comes down to choices, and actively rejecting some of these things that we get told every single day in medicine. You have to do it this way, you have to do that rotation, you have to do it in this certain amount of time, otherwise you'll never be a good doctor, you'll never be that prototypical doctor. But that person doesn't exist.
And at the end of the day, no one's going to ask you how many years you took to do your training. So it's all about creating your own journey and not really caring about this kind of idealized doctor that, you know, medical culture has kind of drilled into you. So yeah, those really good points there, Skye and Tahnee. Just a reminder that if you have any questions for Skye or Tahnee, that you can use the Zoom function to ask us questions, or if you're watching live on Facebook, feel free to use the chat function to ask us questions as well. So I guess talking about my experiences as a medical student, you know, I guess there have been times this year, especially with COVID, where, you know, the feeling of forgetting to look after yourself was a really big thing, especially during the first wave. And this thing that our university has, so I'm from Western Sydney University, is that they give you 20% days off, where they call it Wellbeing days. So you're allowed to take 20% of your placement days off, no questions asked. And, you know, as the year went along, and as I realized that I was starting to burn out, I really decided to take advantage of those days and just really look after myself and do those really basic things that Tahnee mentioned, you know, just cooking for yourself, taking a break, doing a bit more exercise. So I really stress the importance of I guess, being mindful of when you're starting to fizzle out. So,
can I just say, oh, sorry.
Yeah, no, go on. I had nothing else to
I was
add.
just going to say, that is amazing.
Yeah, I was also going to say that.
I am so impressed, because as a medical student, I remember being so burnt out, and, you know, the justification you had to go to get time off, and the effort made it not worth it. So I think that is brilliant that your university has done that.
Absolutely. Mental health days are real sick days. They are real sick days.
Yeah.
Yeah, and those wellbeing days actually weren't implemented like only a few years ago. So the only reason why these wellbeing days were brought up was because students spoke up about the fact that, you know, students were being burnt out, their mental health was being affected by doing, you know, 35-week placements every year. So I guess that goes to show that, you know, as medical students and junior doctors, you do have a place in changing the system. And as Skye said, you are the system. So yeah, that just goes to show, you know, how, you know, we can have an impact.
Yeah, absolutely. And the other thing, you know, to do with that as well is, you know, again, every time you hear of someone on your placement, whether that's as a med student or working as a doctor who might be, you know, calling in sick that day, you know, you have a choice to respond and to make them feel bad about it, or you have a choice to send them a message in response and just say, okay, thanks for letting me know. Hope you feel better. And that's a simple thing. That is a simple thing that you can do that actually rejects the negative aspects of medical culture and makes it okay for that person to have taken a sick day or to take a mental health day or whatever it is. It is such a small thing that everyone can do, no matter how junior you are. You can reject the culture.
For sure, for sure. I think we've actually got one question in the chat here from Belle, and she's asking, let's just have a quick read here. So she says that she's very jealous that Western Sydney gets personal days, no questions asked. And she says that she's found herself in the position this year of asking her sisters, how do I justify a mental health day? Do I need a certificate? What do I tell my tutors? Can I just do that? How do I spend a day not thinking about uni and not feeling guilty at the end of the day? Any tips?
I'm still not great at doing it sometimes. Sometimes I take a day off because I'm feeling burnt out, and I then find myself sitting at home stressing about the fact that I'm not at work. It's again still a learning process for me. But one of the things that I try to do for myself, and I try to do it, even just on weekends or like evenings when I've got time off, I try to set aside a specific amount of time in a day or a few days or whatever, just time in the week where I'm like, this is actually my time where I don't think about anything to do with medicine. I'm actually mentally allocating that time to have a break from thinking about all of this stuff, because I find that if I don't actually plan it into my timetable, then I just keep thinking and I just keep thinking about it and I just keep thinking about it, and I never get that break. Because I don't give myself permission, to have the break. For me, being part of this culture, and it seems silly that, someone might have to do this, but, for me, the culture is so pervasive that if I don't put it in and explicitly give myself the permission to do it, I end up not doing it. And so that's something I try to do every week now.
Yeah. I think what Skye is doing is amazing. I have to admit, and I don't know if Skye will agree with me, but I I definitely am not the ideal role model in terms of well-being. You know, I am a very big advocate for it, but I know that I have a long way to go in actually maintaining my own well-being. And I try to do these things, but I find it very difficult to do. And hopefully that's helpful to hear that, like, you know, I definitely don't fit that perfect role model of, you know, what the doctors should be. One of the things I do is that I've recently moved away from home, and with COVID restrictions easing, I try to get home as much as I can, because whenever I'm with family, I tend to be forced to switch off a little bit. And I find that that helps me, because when I am sort of by myself at home, I tend to just like ruminate about medicine or work or study, or, you know, there's text messages coming through about patients, or, you know, there's always like some reminder that I'm not doing what I think I should be doing. But if there's one bit of advice I could give to sort of younger or more junior people than me, it's to learn those habits early, to learn how to switch off early, and to learn not to feel guilty about it. Because I feel guilty about it, but I definitely shouldn't, and I know I shouldn't. And I don't want other people to kind of get to my stage, which isn't that far along, but to sort of still be like that. It would be nice to think that we can change the way people feel about taking time for themselves.
That's a really good point.
Sorry, Thomas, can I
Go on,
quickly
Skye.
just disagree with Tahnee for 1 second, which is, I actually think the fact that, you know, you're happy to admit that you're imperfect does make you the perfect role model, actually. Because, you know, again, this is real, you know, this is real life, you know. It's not, you know, it's calling in from an airport talking about how we don't have it all together. That's what being a registrar is. You know, and it, you know, it gives people permission when they end up, you know, doing the same thing, or if they're sitting at home in their tracky dacks or whatever, you know, to be okay with that, because this is what we think medicine is. It isn't. You know, this is actually being a doctor at the end of the day. So I think you're a great role model. Yeah.
That is so true. Tahnee, you are the perfect role model. And I think the point that you brought up, you know, just spending more time with family, trying to connect with people outside of the bubble of medicine, especially people who aren't like doctors themselves or medical students themselves, is just so refreshing sometimes, just to get away from it all, turn your phone off, you know, don't read your emails, and just, you know, spend some time away from medicine, whether it be on Friday night or your whole weekend. We've got another question here from Ghassan, and he's talking about the idea of finishing training in the 5 years. So he's asking, what if a doctor doesn't complete, say, psychiatry training at all? And how can he or she move on in life, carrying the failed experience that's going to shape their life forever?
I think it's a great question, and I think it's a you know, these things have been fundamentally ingrained in us. You know, medical school will take this long. You know, internship will take this long. Residency will take this long. You know, being a reg will take this long to finish a program. You know, then you would be a consultant, and maybe you'll do X, Y, Z as a consultant. And it's very hard to, you know, to shift that mindset. But I mean, fundamentally, I mean, you know, I think we should be challenging, you know, these ideas, because at the end of the day, all of these systems are arbitrary. You know, we've decided that these systems exist. There are other parts of the world that operate differently, you know, and they have good quality doctors, and you know, I remember there was an example in one of the meetings I was at recently, where in some parts of Scandinavia, they don't necessarily have fellowship exams for their psychiatry registrars, and arguably Scandinavia still has good psychiatrists. So, you know, some of the that if anyone from the college is watching, there's still time to get rid of the exams. But you know, some of these constructs that we've made for ourselves are just that. They're not truths, they're just constructs.
I think it's really difficult, and to sort of face that kind of, we've always sort of been on this road, and we know exactly where we think we're going, and to sort of it's difficult to deal with uncertainty, I think, for people who are quite perfectionistic or, you know, obsessive. And but to be honest, the most amazing doctors that I have met and I have worked with are the people that have taken the most interesting course. You know, we were talking about a registrar in Melbourne not before this started, and, you know, when I first met her, I thought she was the most amazing doctor I had ever met, and her trajectory was nothing like what I thought like medicine should be, but it was fantastic, and she was brilliant at what she did. And that's been true throughout like my kind of journey in clinical medicine, is that the people I find the most inspiring and the people that are the best at what they do tend to have very different courses, and they do lots of things, and they have lots of life experience, and they can offer their patients, or whether it be clinical or non-clinical medicine, they can offer it a very different perspective, and they do an amazing job. Yeah.
I've got one more question. I think Skye brought up the uncertainty of going through the gamut of psychiatry training. The big thing that's caused uncertainty this year has been COVID-19. So do you guys have any, or do you guys like to share any difficulties, experiences, stresses, or risks that COVID-19 has brought to you as psychiatry registrars specifically, and also more broadly, I guess, to the healthcare industry?
I think for me, one of the biggest reflections is that it's been a very lonely time, actually, in terms of, the rotation that I'm on at the moment. I spend most of my day sort of in my office by myself, seeing people on telehealth, which is very different to what that job would have looked like. That rotation would have looked like, but what it did look like, before the pandemic. And a lot of those opportunities to, you have lunch with the people that you work with. Sorry, Tahnee, I'm going to have to clarify. This is a Victorian perspective, not a Queensland perspective. Those incidental opportunities to socialise with people just in the corridors, seeing your consultant walk by and just asking them a quick question. All of that stuff just really hasn't been possible for a lot of people in a lot of rotations. And I find myself now, particularly as Victoria starts to emerge from a lockdown, thinking about how isolating that's actually been for us as professionals, and particularly in a job where often it's your colleagues that get you through. It's the people that us most doctors, and I'm sure there are some watching, and who would say the same thing. It's often the people that you work with that make you love your job, and that element of it has been reduced or even taken out of the equation for us for quite a while now, and that's been really hard.
I think, I'm in Queensland, so I do feel quite bad for being at an airport, and I have had none of the experiences that Melbourne has had, or even regional Victoria, but so COVID, I guess from my training perspective and things like that, hasn't had a big impact. But I did move in February down to a new hospital and to a new site, and so I think for me the biggest thing was that it was probably the longest I'd ever not seen my family. Like I don't have any family down in South East Queensland in the town that I'm in, and so when we were in that harder lockdown, the only way I could really see them was via VC or, FaceTime. And so I found that quite difficult, moving to a new place where I didn't really know anyone, and where obviously lots of people were isolating and, not catching up. And I think that's one of the things that kind of sparked our discussions around the peer support network, is that, like Skye said, it's really important, those corridor consults, that's peer support, and that's why we really thought about sort of developing this initiative where people could still do that. And it's not the same if you do it via FaceTime or Zoom or whatever, but it's still better than nothing. And those connections are really important. There's actually evidence to show that social connectedness reduces the development of PTSD, depression, anxiety, when you are faced by things like acute or chronic sort of natural disasters. So yeah.
I actually, sorry, Thomas, I keep cutting you off.
That's fine.
I actually have a tute group, and they've been my ongoing group for the past few months, and we've never been able to meet in person. All of the classes have been online, and I like to joke with them that none of them know how tall I am, because they've never seen me. But it's that sort of, it's all of that information about people that you get, from being in a room with someone, and that, we just don't have at the moment. We're doing, Zoom is better than nothing, as you say, Tahnee, but it's also weird to think that, I have these really great relationships with these students, and I have literally no idea, how they would fit into the physical space around me, because I've never seen them except for a tiny little square. Yeah,
that's so true, Skye and Tahnee. COVID has made us go all online with Zoom. And I guess from a med student perspective, that's meant that all our assessments or our lectures or our classes have been online as well. And for me and for all my med student friends, the kind of problem that we've found is, I guess it's blurred our work and life boundaries, because I guess a lot of our spare time is spent at home as well, whether it be in front of the computer or in front of the TV or exercising outside. And I guess being on a computer all day for lectures and classes and then finishing, but you're still at home, kind of just makes it hard to separate medicine from, just ordinary life. So I guess that's one thing that, as med students have found hard. And a second thing is, I guess, missing out on placement time. I know a lot of Melbourne medical students and other Sydney medical students who are around my year level have also missed out on a lot of placement time because of COVID restrictions. And I guess it's made us question a little bit about, how competent are we going to be in a few years' time when we've missed all these months of placements. So I guess those have been like worries that us as med students have, faced over the last few months.
I think to your point, Thomas, I hear that a lot from the students that I engage with, exactly that point around, being worried about how competent they'll be when they graduate because of all of this. And I think what's nice in actually hearing you say it is, I'm thinking about students in Melbourne and you're from Sydney, and it's really the same worry actually at the end of the day. And there's something uniting in that, that actually, no matter where you are sort of in Australia at the moment as a medical student, you have that same worry. And it's unfortunate that you have that worry, but, everyone is still, sort of in it together in a way. Yeah.
Yeah. Even in Queensland, I've heard it, when the lockdown first started, there were a lot of students in various areas that missed out on placement, and it's been definitely a very different year for students, I think, across the country. So,
and I guess keeping up with the rapid rate of change, like with the daily cases and the changing restrictions week by week, has also been quite a stressful thing. Yep. So I guess we'll be finishing up shortly. So I've seen a few more questions pop up in the chat. If you do have any more burning questions for Skye and Tahnee, please submit any final questions that you have, either on the Zoom function or on the Facebook Live function, and we'll try and answer as many as possible. So I've got one more Zoom question here from Robert, and he's asking, how do you help a fellow student deal with their failures in medical school as regards to students who might be facing significant academic hardship?
I guess one thing that I often talk to students about when they're thinking about supporting other students is it's always important, and this is true for doctors as well, frankly, it's always important to remember what your role in this is. And sometimes as students and doctors, we have a propensity to try to put our medical student and doctor hats on when dealing with our colleagues, but that's actually not our role in that situation. Our role in that situation is to be a supportive colleague, and to point that person, if they need more professional supports, to people who are in those professional capacities. Don't underestimate. Sometimes as I think as medical students and doctors, we can feel like we're not doing enough because we might have more skills because of our training, but don't underestimate how important just being a good friend, being a good colleague, and being supportive and validating around the experience can actually be.
Yeah, being a good listener. And I think also it's really important when that sort of thing does happen. I think, from personal experience, when I've had friends who've gone through things like that at medical school, there was a lot of shame and they felt really bad about this, and even just telling you was a big deal. So yep. I think, it's really important that you're not judgmental, and that, instead of doing things like saying, oh, okay, you should study, or I'll do this, or we'll do this, or trying to problem solve, it's probably just important to sit with them and and, you know, take them for coffee or listen to their worries and, you know, I guess sit with their kind of emotions, because at the end of the day, at that point in time, they probably just need someone to talk to and someone to help them through that difficult time.
Yeah. In Victoria, we have the notorious Z score for students when they are graduating, which is for, I guess, people who are out of our state that don't know about it. Everyone basically gets ranked from the highest to the lowest, I guess. It is a very crude way to think about it. It's a very crude instrument. Happy for that to be on the recording, because that's my view. But you know, there is so much stigma and shame around that process and around what number you get, you know, and one of the things I always try to share with my students as well. So my Z score was 2 standard deviations below the average. You know, in a cohort of people who are all very good at, you know, sitting exams, and that's how we all got into medical school. And getting a Z score that was 2 standard deviations below average has not in any way impacted on my capacity to be an excellent doctor at all, frankly. You know, there is no correlation really between, you know, in my view, and I think also the research would support this, you know, in terms of, you know, whether or not you got an extra mark on an exam, you know, does that really mean that you're going to be that much of a better doctor than the person who didn't get that extra mark? No, of course not. But there's so much stigma and shame around, you know, saying this. And when I was a final year, you know, you couldn't have paid me to come on a public forum and say that my Z score was 2 standard deviations below average because of the culture around it. You know, it's taken me a long time to actually be confident to say that was meaningless, and it has no bearing over my capacity to have a great career.
Yeah, I guess it can be hard for us as medical students, you know, when we're always like told that we have to sit all these exams to pass the year, to not get too fixated on marks, and also, you know, the stigma around sharing marks and all that kind of stuff. So I guess it's great to have some of that perspective, to know that, you know, marks in medical school really don't mean anything when you're a registrar and when you're working as a junior doctor. And as Skye is obviously former junior doctor of the year, it doesn't affect.
I didn't want to bring it up, Thomas, but I'm glad that you made the point that it prevents you from winning junior doctor of the year. That is correct.
It goes to show that your Z score doesn't mean anything in the long run. So we've got one more Facebook question here, and this person's actually asking from a non-medical student perspective. So she says that she's currently questioning whether pursuing a traditional career in medicine after completing my degree is the right choice. Any advice for people concerned about the incredibly long, demanding pathway without a fervent passion for medicine?
I think there's a lot of people who question, you know, doing the traditional kind of route in medicine, and I'm definitely one of them. So I think there's nothing wrong with deviating. I, you know, for a period of time really wanted to step into the research world and do something completely removed from clinical medicine, because I loved research, and the prospect of kind of working in a hospital was no longer kind of stirring my passion, or, you know, it wasn't something that I found enjoyable anymore. So I stepped away from clinical medicine, and I did the non-traditional thing at medical school and took a year out to actually do a year of research. And, you know, I came back to medicine, but I don't think there's anything wrong with taking a deviation or doing a non-clinical career. And, you know, for me, research is still something I want to do. And I think that it's something I want in my career, even if I do manage to get a fellowship in psychiatry. And if I don't, well, then I'm quite happy to go down the research path and just do research.
Yeah, I mean, for me, I agree. I think, you know, medicine at the end of the day, no matter what specialty, although you should choose psychiatry if you haven't already, you know, it's really it's a make your own adventure. It is. People will tell you that it's not, and they're wrong, frankly, because, you know, all of the people out there who have created exactly the type of career they want for themselves are proof that those people are wrong. You know, you can do it. Sometimes it is a little bit more difficult. That's not untrue. You know, there may be barriers that you have to overcome, as part of it, and this is not minimizing that, but the take-home point is that if you want to amalgamate your career to look like something a little bit different than just full-time clinical work, you can. People do it all the time, everywhere in this country, and I imagine in New Zealand as well. So I think again, it's we don't just accept what's being told to you by people. You have to do this because that's the way it's always been done, because otherwise you won't get this thing. At the end of the day, if you're a good doctor, people will want to hire you. And if you can only work part-time because you want to do research the other part of the time, will there sometimes be challenges? Yes, absolutely there will be, and that's a problem in medicine and we need to address that. But at the end of the day, there are people that make it work for themselves, and if you're determined to make it work, eventually you'll find a way.
Yeah, those are definitely really good points. And I guess there are medical students and doctors out there who do want to, balance a clinical role in medicine with a non-clinical role, say in research or another pathway. Do you guys have any suggestions or examples of non-clinical pathways that people who are interested in mental health and psychiatry might want to go down besides research? Because I guess full-time clinical work can sometimes be emotionally draining, and there can be an association with burnout with that. So I guess for people out there, are there any suggestions for alternative career paths? I
think just one point, I don't think it's just about burnout too. I think it's about enjoying life and enjoying what you're doing, like Skye said. So sometimes people enjoy doing other things outside of clinical work. One example, I think there's a fair few people who do psychiatry and also have a bit of a legal background. Yeah. Correct me if I'm wrong, Skye. I think you might be in this field.
Look, I'm dipping my toes into that, but I wouldn't claim to have a background in it. But certainly an interest.
There's also lots of people who, find doing things like this, looking at other ways that they can be helpful to the mental health industry or the profession. So people do things like work with Beyond Blue or the Black Dog Institute, or, you can work with the college. You can do things like governance, looking at changing the way we help patients, or advocacy work. There's lots of different, there's a million different fields that you could go into, regardless of your background, whether it's psychiatry or whatever it's interested in. There's so many different fields. And in fact, there is a Facebook group called Creative Careers in Medicine, in case some of those watching haven't heard of it. And it's really quite cool. There's a lot of people in there who talk about different career paths that they've taken. There's people that have written books, started TV shows, got their own podcasts, or, they're sporting stars or they're music stars as well. And they do all these other things that they're passionate about in addition to having a career in medicine. So
you also don't have to do anything exciting, and you are allowed to just use your spare time to watch Netflix if you want to. That's also okay.
True.
Whatever you want to do.
Yes, sorry, I should mention that as well. And I think someone just asked, it's called Creative Careers in Medicine. It's a Facebook group.
Yeah, and I'm part of that too. And it's always amazing to see what people get up to in their lives outside of clinical medicine.
Yeah.
And just a side point, just before we finish, how flexible is, the psychiatry training program in accommodating, interests outside of just clinical medicine itself? Can you do research on the side? Can you do training part-time, or can you take time off?
I think our program, I'm going to go out on a limb and say it's probably one of the most flexible compared to many of the other colleges in terms of for example, number of sick days that you could have in a 6-month period, in terms of going part-time and again, not to minimize that there are still challenges around these things, but I think comparatively, looking at other specialties, there are a lot more opportunities, for our trainees in that regard. Certainly, if I think of, any number of the other psych regs that I know and work with, lots have, interests in other things. My friend Mark Gerblum, is really interested and actually developing quite some expertise around space medicine, for example. You know, that's something that he does, that he ties in actually with his psychiatry interest in all sorts of fascinating ways that you never would have expected, or certainly, well, I didn't expect anyway, until he told me about it. And I think those things are valued in our work, you know, because our work is really about understanding people, and if you know you're participating in your own things as your own person, you're actually better at doing that when it comes to others. Yeah
I agree. I think having interests outside of medicine is important, and like we were saying before, you know, those registrars or doctors that have done other things outside of medicine generally bring with them a lot of life experience and life skills that actually helps them to relate to patients better and actually be able to sort of treat their patients better and all of those sorts of things. It has a lot of benefits overall. So, and it's good to have interests outside of medicine.
Absolutely. I think just looking, you know, again, even if I just think about registrars that I know, if I think about the number of registrars who at some point have worked part-time or at some point who have taken a break in training, I really, and this is anecdotal, I don't have any stats on me right now, but, you know, I really do feel like it would be much higher, you know, in our college than in some of the other colleges. It's a much more common thing to do, I think, or at least it doesn't feel uncommon. It doesn't feel like career, you know, putting your career in jeopardy quite as much as perhaps it does elsewhere in medicine.
That's really great to know that psych training is so flexible and that you can go part-time or take a bit of leave if you want to just pursue your own interests. So I guess before we finish up, I'd just like to invite you both, Skye and Tahnee, to share any final pieces of advice or highlights that we should all take away from this event tonight.
I guess, you know, what I would say, and I said this early on, but I really, and some of my students, if they watch this, will hear me say it many times, but, you know, medicine is about choices. You know, this career is about choices, and the choices that we make really can have profound impacts on the well-being of the people around us, even if those choices feel small and insignificant in the moment. To other people, they are not. To other people, they are significant, and you can choose every day to reject the negative aspects of medical culture and support the people around you.
Tahnee, any final thoughts?
I feel like Skye left us on a high. I don't know if I have anything as inspiring to say. No, I guess the thing that I always say is that we're all human, and I think it's okay to not be okay. It's okay to reach out for help. And like Skye said, I think we are the next generation, and we're the ones that sort of have the power to change the medical culture and the stigma around these help-seeking behaviours and mental illness and well-being in the medical profession. So I think it's really important we keep fighting for that change.
Definitely wise words from you both. And Tahnee, don't put yourself down so much. All right, so before we finish, I'd like to thank you all for attending and engaging in tonight's discussion. I hope you gained some really useful advice, strategies, and insight that you might be able to implement in your own medical career and life in general, and just to help you keep well in these unusual times. Please remember that the college has a wellbeing support hub for members on the RANZCP website, and that PIF members are encouraged to visit if you ever feel that you need support for yourself or a peer. And so this can be found under the membership menu on the website. There are also a couple of other resources that you might want to utilize, such as Tahnee's Hand in Hand, a peer support network for health professionals. Tahnee, how can you access Hand in Hand? Is there a website or Facebook page?
There's multiple. I think the links have been put up. So there's a Facebook group that everyone can join. There's a Facebook page. There's a website. There's Instagram. There's Twitter.
Oh, wow. So you have
and
full
there's an
gamut.
email. So you can reach out to us at any means. And you're also welcome to just contact me, and I can.
You can send Tahnee a smoke signal, carrier pigeon.
I'm sure it'll reach the airport that you're currently in right now, Tahnee. There's also the TEN, the Essential Network, which is a website with mental health resources and a support app for healthcare professionals developed by the Black Dog Institute. So just once again, a big thank you to our panelists, Skye and Tahnee, for sharing their experiences and advice with us all. I hope you definitely learned a lot from tonight. And I definitely learned a lot from just hearing Skye and Tahnee talk about their amazing experiences. Thank you also to the Psychiatry Interest Forum and the RANZCP for putting this wellbeing conversation event together. We really hope you enjoyed it. And please remember to access the resources mentioned if you feel like you need any help and support. So stay safe and well. Thank you and have a good night.